So as promised, here is your review on basic cell physiology and electrolytes and IV fluid types. So atoms carry charges. They can either be positive or negative. Two or more atoms coming together create a molecule. Remember that atoms bond together and share their charges throughout that molecule. So we look at inorganic molecules will give us rise to the electrolytes in our body. So molecules with carbon, such as sugar, is organic, and molecules without carbon, such as table salt, will be inorganic. Water in the body helps to stabilize the electrolyte charges. So salt dissociates in water that breaks down their charges and provides both Na, which is sodium, is a positive charge, and chloride, which is a negative charge. Electrolytes are used in metabolic functions necessary for life. We have cations, which are electrolytes with an overall positive charge, and anions, which is an electrolyte with an overall negative charge. Sodium is an electrolyte in the body. It is the principal extracellular cation needed to regulate the distribution of water throughout the body. Major factor in the adequate cellular perfusion. What it means basically is where sodium goes, water will follow. Regulates the distribution of water between both intercellular and extracellular fluid. Sodium is also a major component of the circulating bicarbonate buffer system and is seen in sodium bicarbonate, and there showed is the chemical breakdown of what sodium bicarbonate is. Sodium and potassium work together in the sodium-potassium pump. That process is also helped by the presence of insulin and epinephrine. Looking at potassium, 98% of the potassium is found in our intercellular spaces. Potassium plays a major role in neuromuscular function, also in conversion of glucose into glycogen. So we look at hypokalemia, which is low potassium. Patients with low potassium are going to have decrease in skeletal muscle function, gastrointestinal disturbances, alterations in their cardiac function, and overstimulation of nerve cells. People that have hyperkalemia or high potassium are going to have hyperstimulation of neural cell transmission, which can result in cardiac arrest. Calcium is a principal cation needed for bone growth. Patients can be hypocalcemic or have low calcium. They're going to have problems with skeletal muscle cramps, abdominal cramps, carpopedal spasms, which is in the hand and the foot, hypotension, and vasoconstriction. Folks who are hyperkalemic or has high calcium can have skeletal muscle weakness, lethargy, ataxia, vasodilation, and hot flush skin. Bicarbonate levels are regulated or related to the conditions of acidosis and alkalosis in the body. Chloride regulates pH in the stomach, and phosphorus regulates or is an important component in the formation of adenosine triphosphate or ATP, which is burnt for energy in the cells. So let's look at the body fluid composition. Fluids found in the body are composed of dissolved elements in water. A solution is a mixture of two things. One is the solvent or fluid that is, or the fluid that does the dissolving, and the other is the solute or what is dissolved in the solvent. So let's make a cup of coffee. Hot water, the solvent, running over the coffee, the solute, produces a solution known as coffee. Balance across the cell membrane has two components. It has the balance of components and the balance of charges. Materials flow from an area of higher concentration to one of lower concentration, establishing a concentration gradient. Depends on whether the cell membrane will allow that material to pass through it or not. So our concentration gradient is the tendency of a substance to flow from a higher concentration to a lower one. Diffusion. Compounds or charges concentrated on one side of a cell membrane will move across it to an area of lower concentration. That process is called diffusion. So filtration is a type of diffusion used by the kidneys to clean the blood. So water carries dissolved compounds across cell membranes of the kidney so that they can be passed out as urine or reabsorbed back by the body as needed. So another part of this process, there's active transport. So active transport is a method used to move compounds to create or maintain an imbalance of charges. An example of this is a sodium-potassium pump. What happens is, as things go to get ready to pass through the cell membrane, it requires another molecule such as ADP to come to the cell membrane and help that potassium ion cross over. So it's a sodium-potassium pump, and it's an example of active transport. Osmosis is another term we need to know. It is the movement of water across a cell membrane. Occurs when there are different concentrations on each side of the membrane. Increasing the concentration of the sodium in the extracellular fluid decreases the water in the fluid. Water moves out of the cell to create the balance of water molecules and to dilute the increased concentrations of sodium. Osmotic pressure increases, yet balanced volume puts pressure against the cell wall. Tonicity of a solution will affect the osmotic pressure or the pressure against the cell wall. An isotonic solution has the same concentration of sodium as does the cell. A hypertonic solution has greater concentration of sodium than the cell itself, and a hypotonic solution has lower concentration of sodium than the cell. So, looking at the example in front of us, if we have a hypotonic solution, it's going to pull fluid from the interstitial areas into the cell itself, causing the cell to swell and bust. If we have an isotonic solution, the cell is going to remain normal and the balance of sodium inside and outside the cell remain the same. If we have a hypertonic solution, there's more sodium outside the cell, which is going to pull the water from in the cell to the extracellular spaces, causing that cell to collapse. So inside of our body, there are three specific places where water can be held. The intercellular area, or within the cell, the extracellular area, or the area outside of the cell. Homeostatic control mechanism ensure that balance is restored and maintained between intercellular and extracellular fluids. The vascular system also has fluid inside of it, and it is the fluid highway. It moves fluids into and out of those areas of extracellular and intercellular cellular places. Again, the fluid compartments in the body are the intervascular, interstitial, and intracellular areas. Perfusion itself occurs in the capillaries as a result of hydrostatic pressures and osmosis in the capillary beds. Intercellular fluid, or ICF, within the cells of the body have large proteins within the cell that draw fluid into the cell. The sodium ions drawn into the cell are removed via the sodium-potassium pump to prevent cellular lysis or rupture of the cell. Some form of water surrounds all cells. It plays a part in cellular metabolism and maintenance of homeostasis. The body adjusts to changes in the balance between ICF and ECF by retaining or eliminating water. Fluid levels in the body are balanced when intake equals outputs. Maintenance of the internal environment of the cell is regulated by several feedback systems. Just remember that when intake and output are misbalanced, that is when things such as dehydration and that will occur. Dehydration. So it's the depletion of the total amount of fluid within the systemic parts of the body. It's more common in older and younger children. Sometimes dehydration will take days to manifest. It may be results of medical conditions. As the fluid is lost from the vascular compartment, the body reacts by shifting interstitial fluid into the vascular areas. This forces a shift of fluid from the intercellular to the extracellular compartments. Total systemic fluid deficit occurs. Signs and symptoms of dehydration include decreased levels of consciousness, orthostatic hypotension, dry mucosal membranes, tachycardia, poor skin turgor, flushed dry skin, decreased urine output. Some of the things that can cause dehydration include diarrhea, vomiting, GI drainage, hemorrhage, insufficient fluid or food intake, and of course infections is always a cause, possible cause. Overhydration. This is when total systemic fluid volume increases in the body. Fluid fills the vascular compartments, filters into the intercellular and interstitial compartments, and the interstitial areas are forced to engorge. Fluid backup can result in death. Signs and symptoms of fluid backup include shortness of breath, puffy eyelids, edema, polyuria or excessive urination, moist crackles in the lungs or rales. Also can account for acute weight gain. Some of those things that can cause that are unmonitored IV lines, kidney failure, prolonged hypoventilation, as well as congestive heart failure. So let's look at IV fluids and how they are composed. Compounds and ions dissolved inside the solution are identical as the ones in the body. Each solution is a concentration of a solute and a solvent. Sodium is used as a benchmark to calculate a solution's tonicity. Concentration of sodium in cells of the body are approximately 0.9%. A common IV fluid is normal saline, and altering the concentration of the sodium in the IV solution can move the water into or out of any fluid compartment of the body. So we look at our normal saline as 0.9%, which matches what's inside of our bodies. So IV solutions are categorized as either a crystalloid or colloid based on their dissolved components or makeup. They are also categorized as isotonic, hypotonic, and hypertonic based on their tonicity. Crystalloid solutions have dissolved crystals in water. They contain compounds that are quickly dissociated in the solution. They are the best choice of pre-hospital care of injured patients with body fluid loss. They have a 3-to-1 replacement rule. 3 milliliters of isotonic solution is needed to replace 1 milliliter of blood. They do not have the capability to carry oxygen, and boluses of 250 ml should be given to maintain perfusion, which is maintaining a radial pulse, but do not restore the blood pressure to normotensive levels. Increasing blood pressure with an IV solution dilutes the remaining blood volume, dilutes the red blood cells, and it may increase internal bleeding by interfering with homeostasis and the clotting process. So when we're looking at maintaining perfusion, we want to focus our fluid resuscitation on maintaining a good radial pulse. So we look at our fluid boluses being about 200 to 300 mLs per bolus, and then reassessing for the presence of a radial pulse. Bringing our patient back up to a normal blood pressure is not what we're looking for as a result of our fluid challenges and our fluid replacement. Colloid solutions are another type of IV solution out there. They contain molecules, usually proteins, that are too large to pass out of the capillary membrane, and they remain in the vascular compartment. They have very high osmolarity rates. They draw fluid from the interstitial and intracellular compartments into the vascular system. They work well in reducing edema while expanding the vascular compartment. Um, these are good fluid, or they could cause very dramatic fluid shifts into different compartments of the body. An example of a colloid solution will be albumin and white whole blood, which we don't carry. IV solutions are characterized by their tonicity as well. There are three categories: isotonic, which is 0.9% sodium fluoride, which is the normal saline and lactated ringers we carry in the field. A hypotonic example is D5W, and a hypertonic is 3% saline or blood products. The fluids we carry in the field are specifically categorized into isotonic or hypotonic. So isotonic solutions have nearly the same osmolarity as serum and other body fluids. They expand the contents of the intravascular compartment without shifting fluid to or from other compartments. So fluids will remain in the vascular compartment, so be careful to avoid fluid overloading. Patients with hypertension and heart failure are at a great risk for fluid overload. Lactated ringer solution is generally used in the field for patients who have lost large amounts of blood. D5W is a special type of isotonic solution as long as it remains in the bag. Once it's in the body and after administration, the dextrose is quickly metabolized and the solution then becomes a hypotonic solution. The hypotonic solutions have a lower concentration of sodium than the cell. So what that means is they will hydrate the cells while depleting the vascular compartment because the concentration of sodium is higher in the cell, so it's going to pull that vascular fluid, intravascular fluid, toward the cells. These are really good in patients who are on diuretic therapy or on dialysis. Also really good in treating patients with DKA. They are dangerous to use because they can cause a sudden fluid shift into the intravascular space of the cell. They're also dangerous to use on patients experiencing a stroke or head trauma, or patients with burns, trauma, malnutrition, or liver disease. These are not the fluids we want to use for these kind of patients. So with hypertonic solutions, osmolarity is higher than the serum, which means that it's going to shift body fluids into the vascular space and pull the fluid and electrolytes from the intercellular and interstitial compartments into the intravascular compartment. This helps stabilize blood pressure and increases urine output and helps reduce edema. Rarely used in the pre-hospital setting. Careful monitoring is always needed with this type of fluid to guard against fluid overloading. And these folks should not be given to patients with diabetic ketoacidosis and other risk of cellular dehydration. So that is the quick review over the different types of fluids and the electrolytes that are in the body. I hope it helps some of you guys with this. And again, we're always here to answer questions you may have.